FDA declared a nationwide shortage of Adderall because there's so much demand and there are supply issues. And this could last into next year.
Licensed clinical psychologist and author Dr. Jamie Zuckerman joins us now. Doctor, remind us all, what is Adderall?
Adderall is a medication, stimulant medication used for ADHD to help people be able to focus better, concentrate better, and just kind of perform better in their day-to-day.
Why a shortage then?
So there's a couple reasons. One, there is a increase in demands, which a lot happens over the pandemic. There's a lot more diagnoses. There was ease to get the medication because of online appointments that you could have. So it just made things easier. People were seeing symptoms that maybe they hadn't seen before in their workplace. Structures and routines went out the window, so symptoms became a lot more apparent.
Well, it's such a problem for our kids. I mean, so many children, it's really important for them to be able to focus in school.
That's right.
And you can't just be switching things up willy-nilly when people have routine and structure. So what do you do if you have, for example, elementary school kids that are on this?
So there's a couple things. One, there are other medications the FDA is listing and different dosages. So that is something that you can do.
Can the pharmacists do that? Because I think they were having some problems getting some of the ingredients. The pharmacists are able to make these different, or to compound different things?
So there's other types of non-stimulant ADHD medications that are available. So it's obviously something you want to talk to your provider about to see if that is something that could benefit you.
Okay.
So other drugs that are... Do they do the same thing if it's not a stimulant? Okay.
They do the same thing. They work in a different way. But again, it's something, if you've been on a medication for a long time, you really want to speak to your provider before you just switch.
Yeah, you just can't stop.
Correct.
There's got to be a transition. Do supplements work?
So supplements do work. Again, you want to talk to your provider to see what would work for you, best for your treatment.
What do you mean by supplements?
Supplements for, fish oil, things like that. Things that can improve concentration, attention. Again, is not ideal, but in this kind of shortage that we're in, it's something that you definitely want to consider.
And then you always talk about routine and disruptions in this child's life. Boy, talk about a disruption. It's called a pandemic.
I know. So this happened for children and adults. In fact, there was such an increase in adult diagnoses during the pandemic, so that definitely is driving the shortage as well. But routine and structure, I talk about this all the time, like you said, is so critical, because if you have ADHD and you go outside of your structure and outside of your routine, for somebody who doesn't have ADHD, it's extremely difficult. For somebody who does, who depends on that routine, it can be really tricky. So you want to maintain as much of a routine, sleep, exercise, all the things that we talk about.
It's such a challenge. I just feel like your kids are they're running around doing all these different things, and it's just a really frustrating situation. I have some friends where they just had kids that were just diagnosed, and you're already trying to get them onto something, and sometimes it can have, different, will the new stuff have, or the different things, could they have side effects that you should know about that would be different than what they were already on if they were on like an Adderall?
Sure, always. You always want to check with the provider about side effects, because all these medications, particularly in kids and adults, can affect them differently.
Is there a brand name of an Adderall substitute?
So a non-stimulant would be Strattera, would be an example.
Strattera. Okay, well, good luck, folks.
And
My
therapy.
goodness.
Behavior therapy is always something that you'd want to add in as well to help them.
And like you said, get them up and moving around if they're inclined to do that.
Yeah.
All right.
I have so many questions. It's such a frustrating situation. Thank you for coming in.
Yeah,
We appreciate
sure, my
it.
pleasure.
Thank you, Dr. Z.